couldn't see it. There's pretty good glare. Hello, and welcome to this video. In this video tonight, we are going to be explaining the top budget-friendly insurance options for those who are on Medicare. We've been helping people with Medicare for the last 15 years, and during that time, we've learned a lot for people who are on a fixed income, how to make sure you're not just spending all of your money on insurance. After we go through that, we will do, as we always do, we're going to do some question and answer. Oftentimes, we sit around for 60 or 75 minutes and answer questions. So go ahead, feel free to start putting your questions in that chat, and then we will go through them in the order they are received. My name is Josh Music. This is my dad, Marvin Music. Together, we started this company right back here, MedicareSchool.com. And it's grown to the point where today we have a team of people and we help about 1,500 to 2,000 people every single month begin their Medicare journey. And really, we started this company with two goals. We wanted to educate people, right, instead of just selling them a plan. We want to educate people so that then they could have the confidence to reach out to us and then we could help them choose the right plan. So really, that's all we do here. Educate people about Medicare, and then we have a team of people. The phone number is scrolling along the bottom of the screen. You can call us anytime. Schedule an appointment to talk to one of our agents. We work in all 50 states in the country, and we would be honored and it'd be a privilege to assist you guys with Medicare Advantage plans, supplement plans, drug plans, dental plans, enrolling in Medicare, Social Security, you name it, anything related to Medicare, we would love to help. So go ahead, start putting your questions in the chat while we wait for everyone to log in. Do me a favor. Tell us where you're tuning in from. So just type in if you're from Florida or Georgia or wherever. Tell us where you're tuning in from. We are in our headquarters, Overland Park, Kansas, which is a suburb of Kansas City. So we're just good Midwestern people, and love to see where you're coming from. Somebody's from Earth. Well, that's good, James. Got Oklahoma, California, Ohio, Florida, Dallas, Texas, Idaho, North Carolina, California, Cary, North Carolina, Jeffersonville, Nebraska. Washington State, Arkansas, welcome, Archie Heaven, Ohio, Washington State, Maryland, Georgia. It's really exciting for us to know that we're able to help people all over the country. So without further ado, this is my dad, Marvin Music. He's going to teach you all about the top budget-friendly insurance options for those who are on Medicare.
All right, so I'm going to briefly discuss how there could be some ways you could save money. I'm going to kind of break this down into those of you that are already on Medicare, how you may be able to save money. Those of you that are going to start Medicare plans, we'll talk about how you may want to save money. And then also just want to talk really first with Medicare A and B, because oddly enough, some people could save some money on A and B. Now, the majority of people that are on Medicare A have it at no cost. It's usually zero premium. Medicare requires that we pay into the Medicare tax system for 40 quarters, 10 years worth of work. 99% of all of you have that already, but there are some people out there that actually have to pay for Medicare A. And right now it's expensive. Someone that has between 30 to 39 quarters is actually paying $278 a month. If someone has less than 30 quarters, they pay $505 a month. So how can they save money? Well, you can actually apply for some programs that will actually help you with your Medicare A. And so if you didn't work a lot, that's why you're having to buy it, you may qualify to get A. And I'm just going to tell you how that works. It's called Qualified Medicare Beneficiary, and there's another status called Qualified Disabled and Worker Individual. So there's a couple programs that actually will help you pay for your Part A. You can apply for those through Medicare. You can apply for those through your state Medicaid agency. So that's one way. And again, that's not going to affect a lot of people, but I think people need to know about that. Another way that you can save Medicare that would be on the Part B. And that, again, would be through your state Medicaid program. Right now, most people are paying $174.70 a month for Medicare Part B. And many states will actually help pay that Part B premium. So if money is really, really tight, income's low, assets are low, you may qualify. So again, I would reach out and try to qualify for one of those programs. Those are officially called Medicare Savings Programs. So they're all about helping with A and all about helping with B. All right, so enough of that. Now let's talk about those of you that are just starting Medicare. And there are some ways in which you can save money. Now, I want to break those of you down into two groups that are starting Medicare. Those of you that are healthy and those of you that are not healthy. Because those of you that are healthy, probably the lowest cost way for you to get insured as far as a monthly premium goes is to do some type of an Advantage plan. Now, when we're on an Advantage plan, you still have to pay your Medicare B premium unless you're on Medicaid. But the Advantage companies have plans today that have zero premium. So if money is really, really tight, budget's tight, then we encourage people to get a Medicare Advantage plan. And so that's a way that you can start Medicare, save money, still got to pay Medicare B, but no premium to the insurance company. Now, if you want really your best value financially, you would get an HMO plan because those typically have less max out of pocket than PPOs. Sometimes we can see an HMO that has a $2,000 or $3,000 max out of pocket. A PPO may be $5,000 or $7,000. So if my money is really tight, I'd be enrolling into an HMO. Now you got to keep in mind when you do that, you're going to have less provider options because HMO networks are always smaller than PPO networks. But you may find that your doctors are covered by the HMO plan, and so if you had some kind of an illness, your max out of pocket is going to be substantially less. All right, and so that's one way you could do it. Now, let's say you're presently unhealthy and you're getting ready to start Medicare. I would tell you that the way you can save money would be to go with a supplemental plan. Because if you have health problems, you're going to spend more money out of pocket on the Advantage plan than you're going to spend out of pocket on your monthly premiums for a supplemental plan. And so I would highly encourage those of you that have health issues, don't do an Advantage plan. If you can afford just a little extra on a monthly basis, in the long term, you'll save substantial money because those max out of pockets, people can reach those every year. And again, they could be anywhere from $3,000 to $10,000. And so those of you unhealthy, I would really do a supplemental plan. Now, the way you can save money on supplemental plans is to do an N plan instead of a G plan. By the way, I like both of them, but N plans are going to have a lower premium by about $30 or $40 a month. And so you may want to consider, if you're unhealthy, going on a supplemental plan and taking that N plan. You do have a little extra risk on the N plan versus the G, but if money's tight, I still think that's a very good move for people. All right, now those of you that are already on plans, let's talk about you. How can you save money? Well, you do have about 10 more days if you are on an Advantage plan to switch that. And why would I recommend that? Well, again, you may be on a PPO plan that has a max out of pocket of $5,000 a year. If you switch to an HMO now up until March 31, you can lower that max out of pocket and usually pick up a few additional perks with that HMO plan that's offered that probably is not offered on the PPO plan. Higher dental benefit. They may offset some of your Part B costs. In other words, sometimes those HMO plans can be a little bit more favorable financially for you.
So just to pause, so we're in this period called open enrollment period. And so if you're on an Advantage plan, you've got, 9 days, 10 days left till the 31st to be able to make a change from one to the next.
That's right. Yeah, that's right. And I should have said that. Anyone that owns an Advantage plan on January 1 has the next 3 months, one time during that 3 months, to switch their Advantage plans if they want to. And so if you can improve your position financially, then you still have, like Josh said, until March 31 to do that.
And then that coverage then would start April 1st.
Exactly right. Exactly right. Okay, so that would be a way that can happen. So that would be those of you that are on Advantage plans. Now, those of you that are watching that are already on Medicare supplemental plans, there are some ways you can save money, and that would be if you switch plans. And so some of you may be on F plans. You started your Medicare before January 1 of 2020. That group of people that did that were grandfathered in. They got to keep their F plans. And so you may consider moving from an F plan to a G plan or an F plan to an N plan. And sometimes we see people save substantial money. I mean, we're talking, $100 a month or so getting off the F plan. So that would be an option for sure. Those of you that are on G, you may want to move to an N. And so that would be a way if you're presently in the Medicare supplemental system. Now, I do want to clarify that unless you're in a state that has what we would say an open enrollment period, sometimes those are year-round, sometimes a couple months a year, or you're in what we call a birthday rule state, which there's 10 of those. 10 birthday rule states, 5 states that have an open enrollment season. So we have 15 states where the rules are just a little bit different. But if you're in the other 35 states, you're going to have to medically qualify to make that move from an F to a G or to a G to an N. It's not going to be automatic in most cases. So let me just quickly just run through those birthday rule states because there's 10 of them. What this means is that around your birthday, and some states are 30 days before your birthday, maybe 30 days after. Some states are, it's from your birthday for the next 60 days or 90 days. But during this window, you have the opportunity to do this. Without any underwriting, you can move from your plan to a like plan or your plan to a less plan. So you can move from an F to a G, you can move to maybe an F to an N, and there would be no medical qualifications. You can move G to G or G to N. So we never can improve our benefits, but we can go like to like or like to less in birthday rule states. So let me just rattle them off for you, and then you can, of course, call us, and we're happy to give you more information. But here's the point. California is a birthday rule state. Oregon is. Washington State is, but it's year-round. You have to own plan, but it's year-round. And then we have Idaho, the state of Nevada, the state of Oklahoma, Louisiana, Illinois. Missouri is, they don't call it birthday rule, it's the same concept, but it's tied to the effective date of the policy. We call that anniversary, but the concept's still the same. And then the state of Maryland. And so those are 10 states where you can move at a certain time of year without any underwriting at all. And so that may be a way for you to save money, especially if you can't qualify through underwriting. I just want to clarify one more thing, and then we're going to start taking questions. You may live in New York or Connecticut, and those states actually have an open year-round where those people can switch those plans without medical qualifying. The state of Vermont allows it, but there's only 2 carriers that do it, and that's Mutual of Omaha and United Healthcare. The state of Massachusetts allows it, but only February and March. And then Maine allows it, but only the month of June. So in other words, there's certain restrictions for those. So again, just some ideas about saving money if you're on a supplemental plan right now. If you don't live in one of those states I just mentioned, we'd be happy to talk to you about to see if you can medically qualify. And Josh would know this. There are some carriers that are a little more strict than others. So once we ask you a few health questions, we can pretty much tell whether we can get you moved or not. But those are ways to save money. And then lastly, I do just want to quickly talk about Part D plans. Now, if you're on a supplemental plan, you have a Part D plan more than likely. You can't do anything about that right now as a general rule. You're going to have to wait till later this year to change drug plans, but it is wise to do that. And the beautiful thing, about drug plans is they're drastically, they improved this year. Because now the max out of pocket that anyone's going to spend this year is going to be in the range of about $3,350 to about $3,750. Max out of pocket. They could be on Stelara. I just looked it up today. The normal dosage for Stelara, which is for psoriatic arthritis, Crohn's disease, is $13,500 a month. But if someone's on that medication, they'll spend no more than that, $3,350 this year because we have no catastrophic phase, so they put a cap on it. 2025, the cap is $2,000. So just because Medicare made some changes, you're automatically going to be able to save some money on those expensive drugs moving forward. All right, so those are some ideas to help your financial situation.
Okay, let us launch into questions. Before we do that, if you would, everyone, please hit the, is it a like button? There's a thumbs up button on this video. Just tap around on your screen, look for a thumbs up button. Hit that. That lets the YouTube gods know that you like this video, you're learning something, and then it pushes it out to other people as a suggestion to watch. So if you would, hit that like button or that thumbs up button right now. We are going to now move into a lot of question and answers, but I just want to remind you, if at any point along this video you say, hey, I need some Medicare help, there is a phone number scrolling along the bottom of the screen, right down here. Let's see, I can't see it. And if you need Medicare enrollment or assistance, give us a call. Okay, first question. JRM says, I'm living on Social Security income of $804 per month. How much will the government take if I choose to not apply for Medicare or any other insurance, including VA benefits?
Okay, well, first off, if you have SSI, that is supplemental security income.
He might have meant Social Security income.
Oh, okay. Well, Okay, very good. So how much is the government take if I choose not to apply? Here's the thing, you actually, income-wise, I don't know where you stand on your assets, but income-wise, you definitely would qualify for the Medicare Savings Program to offset your Medicare Part B. And what happens if you qualify for that program, the providers you go to are not able to actually bill you co-insurance, co-pays, or anything. So what you ought to be applying for would be that Medicare Savings Program as well as extra help, because you're probably not going to be out of pocket anything. They won't charge you for your Medicare B, and you'll have no out-of-pocket expenses at all for your medical. You also qualify for what's called a dual eligible plan, which is a Medicare Advantage plan. That's for Medicaid eligible folks. And with that come a lot of perks. Those are called dual plans. And so we write those all the time. Happy to help you if you need some assistance with that. So zero for you. And of course, VA, you can continue to get what I would do, I would get your medications through VA. And then enroll in what we call an MA only plan. So you have a civilian option. It's called Medicare Advantage only, and that'll be a wonderful package for you. So that's what I'd recommend. Let's keep going.
Okay, next one. James Lagore says, I'm working full-time with medical benefits. I will be 65 in June. What do I need to know?
Okay, well, as long as, James, your employer has 20 employees on the payroll or more, you don't have to do anything at all with Medicare A or B. You can delay A, you can delay B. Now, I would tell you that if you don't have right now, James, an HSA, I would enroll in Medicare A only. It's not going to hurt you to do it. The only people that are hurt while they're still working, if they enroll in A only, are those that are contributing to a health savings account, HSA. So we tell people on HSAs, if you're going to keep working where your spouse is, and want to keep contributing to the HSA, do not enroll in Medicare A, because if you do, you can put no new money into the HSA account. So that's my recommendation. Stay on the group plan. And by the way, James, it's not a bad idea to compare your group plan with your Medicare option. We're happy to help you with that. But if the group plan makes sense financially, it's a good value, good coverage, stay on the plan. Medicare does not require you to do anything at all with Medicare as long as you're working. Now, once you get ready to retire, that's going to change.
Okay, next one. Will be turning 65 on July 1st this year and currently have health insurance through the marketplace. Medicare will be much more expensive. Can I stay on what I have now?
Okay, well, let me tell you, what will happen, and number one, if your birthday is July 1, your Medicare is going to begin June 1. And right now it is true, the marketplace is a good value for you, but that will no longer happen effective June 1 because your tax subsidies, your reduced premium, your cost sharing that the government's paying for is going to be eliminated. They will no longer help you, and I promise you, you'll find that out. A lot of people find out too late. So that all the benefits of that marketplace plan will go away June the 1st, for sure. Okay, they basically force you to go on Medicare. There's no reason to keep a marketplace plan once you're Medicare eligible because all those benefits are gone. I promise you, you'll pay full cost, full premium, everything. So you're going on Medicare.
Okay, James Knappen says, does the 100 days in a skilled nursing home start when you're in the rehab hospital or when you're released?
Okay, well, whenever you're admitted to skilled nursing facility, the 100 days is going to begin. Yeah, so that's the way it works. And if it's a rehab hospital, if that's considered, I think it'd be just considered a normal hospital. But point is, day you're released from an inpatient status in the hospital, you're going to start the 100 days.
Bedazzled 64 says, I want to stay in original Medicare, but Plan G is expensive in Florida. Would N be the next best option?
Yeah. I'm not sure. I mean, we write in Florida all the time. In fact, it's one of our top 3 states. I couldn't tell you right off the top of my head what an N premium is, but my understanding is most of our agents, when they are working with people in Florida, they are getting N plans. So I believe that would be accurate.
Okay. Next one.
And let me just clarify something for all you watching. Listen, the only difference between G and N is 2 things. G plan pays excess, N does not. Now, excess that's when the doctor adds the 15% to the bill. It does not happen often. It happens less than 5% of the time. So the likelihood of you seeing excess is small. It does happen, especially in cancer type situations. And the second thing is N does have a couple of copays. And that would be every time you see a doctor, specialist, anyone, you're subject to a $20 copay. Go to the emergency room, it's $50. But again, if we're saving $60, $80 a month or $100 between the G and the N, I think the N does make sense.
Cool. Okay. How hard is it, Joan asked, how hard is it to switch from Part C Advantage to a Medigap plan in New York State? Does it have to be underwritten?
Okay, no. Advantage plans, in fact, you can do that right now, Joan, because you're still in
Now
that
is the
period.
time
Yeah,
to do
you
it.
need to do it next 10 days. There will be no underwriting at all. New York is a continuous open enrollment state. Okay, so there's no medical questions asked whatsoever. So you can do it, but you need to do that now because you still have to be eligible to disenroll from your Advantage plan and return to your original Medicare, and you can only do that from January 1 to March 31st or October 15th to December 7th. So you're good to go on that.
Okay. Plan to sign up for original Medicare, not Part D. Will be 65 in 3 months and currently on Medicaid. How does that work? Live in Ohio. Does Medicaid become supplemental insurance?
Okay, well, number one, when you're on Medicaid, if you do not sign up for a Part D plan, your state Medicaid will do it for you because they don't want to be responsible for the bulk of your medication. So I guarantee you're going to have to be on a Part D plan. I would rather select my own because basically what happens when they select it, they don't know your medication, so they're just going to put you through the lottery. So I would prefer to pick out your own. And by the way, there's some that are very low cost, and plus Medicaid's going to offset the expense of that anyway. So you want a Part D plan. So you're saying, does Medicaid become supplemental insurance? It's not called supplemental. What happens is it will pay. It'll pay after Medicare is going to pay. What I would recommend in your situation, as long as that Medicaid eligibility is going to continue on, I would enroll in what I mentioned earlier, a dual eligible plan. You have Medicare, you have Medicaid, and there's special Medicare Advantage plan designed for you. And they really are full of wonderful benefits. There's no premium, there's no out-of-pocket expense for you whatsoever. And we'd be happy to help you with that. That really would be your best option. So that's what I would do.
Andre Colombo says, turning 65 in June, thinking about B, D, and N plan. How do I start the process to get the best rates? Will be off employer plan in May.
Okay, very good. That sounds good. Well, please call the 800 number there or find some broker. We're brokers, and so we look at multiple companies, multiple options. We do emphasize the fact that we want to look at also the rate history of the carrier. If you go with an N plan, which I think is smart, we'll look at several end plans and talk about those carriers and kind of look back to see what their price increases have been the last 10 years. Happy to share all that information with you because our goal is always to get a rate stable company. Now, folks, we have no control over the rates, but what we have found is there are some companies that tend to be more stable than others. We'll share that with you. And our goal is, not only just to get a good initial premium, but go with a company that's going to be solid for the next 3, 5, 10 years. And yeah, they're all going up, but some go up more than others. So we'd be happy to help you with that.
John Batty, I have Medicare as of December 23. I'm 59. Why can't I get a gap in coverage?
Well, here's why, John, because the federal guidelines do not dictate that insurance companies write supplemental plans for people that came into Medicare through disability. Federal guidelines says that does not have to happen. So there are many states that follow the federal guidelines. So you happen to live in a state where you just can't get them because the state insurance commissioner has not made that happen. Now there are probably a dozen states where the insurance companies have to write those. And so sometimes they have to honor the same kind of rates, and other times they can actually charge more. But that's why you can't get it. You obviously live in a state that follow federal guidelines. The state has not made it more consumer friendly. But here's the good thing, John. Though I'm sad that you're in that position, you can get an Advantage plan for sure. And then when you turn 65, you're going to have a second eligibility. And then, which I know is going to be 6 years out, then you'll be able to pick a supplemental plan because you have a second opportunity. We call that initial enrollment period 2.
Okay. When I file for Social Security, my wife will still be working. How is our income limit figured, or will there be a limit until she retires? Also, same scenario, is there a negative impact on taxes? Maybe answer the first part.
Yeah, exactly right. So what's going to happen, her income will have no effect on you in regards to the earnings test. And I think that's what you're talking about. And so right now, the low limit for earnings test is $22,320, James. So they're not going to look at her income. They're going to look at your working wages. It's not investment income, pensions, annuities, distributions from IRAs. It's only working wages. So as long as you stay below the $22,320 on your own wages, there will be no impact at all for your Social Security. Now, I want to make a side note here. the year that we turn full retirement age, and my emphasis was the year we turn. I'm not yet full retirement age, but the year I turn, that number goes up substantially. This year it's $59,520. But the month and year I actually turn full retirement age, earnings test goes away. You can make as much money as you want, and there's no impact on your Social Security check whatsoever. A negative impact on taxes, that will affect you, just so you know. And that number this year is a married couple that's below $32,000, you'll pay zero income taxes on your Social Security. If you're between $44,000 and $32,000, 50% of your Social Security is taxable. And if you're above the $44,000, then 85% of your Social Security will be taxable. Then that's going to be joint income if you file a joint return.
Okay, Mark Hansen, can you explain the differences between Part G and Part A? And you already did, but maybe hit it again real quick.
Yeah, G covers 5 of the 6 gaps. When someone has a G plan today, it's the most comprehensive plan available if you're born after January 1st, 55. And so it will not cover the B deductible. That's the one gap on the G. The N plan has 2 gaps. You pay the B deductible, you pay excess charges, that extra 15% if and when that ever happens, and then you have those co-pays to the doctor of $20, $50 to the ER. That's the difference, and a lower premium on the end. Most states, what, Josh, $30 a month difference between G and N. Some states it definitely could be more than that or less, but there's a monthly premium savings as well.
This is a good question. Samuel Levi says, my wife just hit 65. She's on Social Security disability since 2010. She's been covered by employer coverage since 05. When I retire and her Medicare becomes her primary, can she get a sup plan?
Okay, she can. What I am assuming in your situation is that she does have, I'm assuming, Medicare A only. I assume she didn't take Medicare B. And so what will happen when you get off the group plan and she goes on Medicare, or she gets off the group plan, goes on Medicare, then that's when you'll start your B date. And then what happens is you'll be in what's called a Medigap open enrollment period. And that's a 6-month window before B date or after B date where you can apply for a Medicare supplemental plan, no health questions asked whatsoever. So that's what'll happen. So she can definitely get one because it's going to be tied to her B date.
Okay. I think this is a good opportunity. Linda Starr says, I need major dental work, and it looks like what I have will not cover something I've needed for years. Must wait 1 year, then I pay 80%. So maybe just talk about dental coverage on Medicare.
Right, okay. Of course, Medicare doesn't cover anything dental unless it's cancer related or you're getting ready to have a heart valve replacement or something. So just count Medicare, not going to cover anything for dental. And so what has happened, Linda, is you've enrolled in a plan that has a 1-year waiting period on major services. And so that's just the way it goes. So my advice to really anyone that is going to stop working and go on Medicare, the best time to get a dental plan is within no more than 63 days of when you lose the group plan, because most dental companies will let you take their insurance and they waive the waiting periods as long as there's been no more than 63-day gap. So those of you that are going on, that's the right time to buy a dental plan. Now for you, Linda, there's really not much that you can do at all. It's just the way it is. And I'm sorry you're having to undergo that. One thing you may want to do is look at maybe having multiple plans. I've heard of people having 2 dental plans, and one will pay and then the other one will pay. So that may be something that could help you. I know you're going to have to pay a premium for that. But if you get a good plan, most of the plans we right now to about $3,000 a year in dental benefit. And again, you're going to have to go through that waiting period, but if you can be patient.
Some that have 5, yeah.
Yeah. Wow.
Okay, Penny Pearson, this is a good opportunity as well. Hey guys, real quick, I want to stop. If, just for those who may just now be joining, so my dad and I started this company back here that's on the wall, MedicareSchool.com, and every month we help between 1,500 and 2,000 people start Medicare from A to Z. So meaning they're maybe completely confused and they come out the other end after working with us completely confident that they chose the plans that were right for them right now and right for them for the future. We don't believe that people should have to switch their insurance every year. It's not really like that. If you choose right the first time, it should last you for many, many years. Mm-hmm. So if you need assistance, our services are always free. Yep. So you call us. We're going to get on a screen share like a Zoom, and you're going to be able to see the people on our team, and they're going to share their screen, and they're going to walk you through all of the different options that are available to you, whether that's supplemental plans or advantage plans or drug plans or dental plans, all these different health insurance, medical, and ancillary plans that you may need. Show you all the prices. We're brokers, which means we represent most of those companies that are filling up your mailboxes with prices and quotes. And really what our goal is to do is just match you and what you need to the correct plan. Explain it away so that you understand it, so that you walk away confident you're choosing the right thing. So if you need assistance, there's a phone number scrolling along the bottom of the screen here. 800-864-8890. We would love to help you. You can call in. You can schedule an appointment with somebody who's here on our team.
That's good. And I just want to add two things to that, Josh. And that is, you hope you understand this, that the insurance companies set the premium. We don't do that. If you went directly to an insurance company and they charge $110 for a plan, that's exactly the price we're going to give you. So keep that in mind. There's no difference in price, folks. And then secondly, you don't have to pay us. Insurance companies set the premiums, and insurance companies always pay the agent. Okay, so we truly, truly are free to you. We don't work for free. We couldn't do that, but you don't have to pay us. Insurance companies will take care of that for you, which is wonderful. So we answer this question here. Differences between Advantage plans and old-fashioned Medicare. Let me tell you the differences. I like to always start with one thing they have in common. Got to be enrolled in Medicare A and B to have Advantage. Got to be enrolled in A and B to have a supplemental plan. But beyond that, here are the major differences. Number one, Advantage plans will always have a network of providers that you need to go to, HMOs or PPOs. Old-fashioned, she's calling it, or he is, traditional Medicare, there's no network. You actually can go to any provider as long as the provider takes original Medicare. 100% of hospitals do, 99% of doctors do. Okay, so that's the difference. So with Advantage, you're going to have some limitations with the network. With the supplemental plans, you're not going to at all because it's an open access system. Number two, the way you pay for them. Advantage plans, other than paying Medicare, that B premium, they typically don't have a premium. There's actually almost 4,000 plans in America right now with Advantage. 2 out of every 3 have 0 premium. Why is that? Because the way you pay for them is you pay as you go. You go to the hospital, $350 a day. Have an outpatient surgery, probably $300. Have a CAT scan, probably $200. See a specialist, $50. So you pay co-pays instead of premiums on the Advantage plan. With the supplemental plan, let's say if you get a G plan, you don't have all that. All you have to do is meet a deductible once a year because you're paying a premium to the insurance company to get rid of all those co-pays and deductibles and all those kinds of things. So the way you pay for them is different. And then thirdly, I think it's important to note that, and this is really the biggest difference as far as your care is concerned. Not only can you go to any provider you want with traditional Medicare, as long as they take it, you also have no pre-authorizations. So on the Advantage plans, what people find is about 70 to 72% of the services they need must be approved by the Advantage company. So doctor says you need a knee replacement, hip replacement, you need a CAT scan, MRI. Just because doctor says you need it doesn't mean you're going to get it. The Advantage plan has to approve that and agree with the doctor. And sometimes they do. And sometimes they delay that approval or deny that approval. That's the way the system works. But when we have a supplemental plan, you don't have any kind of insurance interference because supplemental plans follow Medicare. So if Medicare says we'll cover that, doctor says you need that, end of story. Goes on the schedule, you get the knee replacement, the hip replacement, the scan, whatever it is, because the insurance company has no say-so whatsoever. Your doctor and Medicare are going to make those decisions. That's the big differences.
Okay, next question. CDH says, retiring August 2nd, age 69. Will lose my company-sponsored insurance. Need your help.
All right. Glad to do it. CDH, you're coming into Medicare obviously way beyond 65. And so you're going to come in using what's called the special enrollment period. Special enrollment period. And what that requires is that we're going to have to, and we're happy to go through all this with you, we're going to have to verify you've had credible insurance through an employer plan, either you or your spouse's, back to 65. So we have to have the history of that for 4 years. The forms that we use for that are called an L564. Our staff would do all this for you. You've got to get it to your HR department to verify credible coverage. And there's one other form that you have to use called a 40B. And the 40B is the form that we're going to use to say to Medicare that we want to start our declare Medicare for you probably is going to be September 1. And on the 40B form, your name's on there, Social Security number, a little comment section, please begin my Medicare September 1, 2024. And those two documents go to your local Social Security office, and you're coming in under that process using that paperwork. And I promise you, you'll have no penalties, you'll have no problems whatsoever, and we can help you and really walk you through the whole process. Be delighted to do that. Give us a call.
Okay, next question. I signed up. Ted Shaver says, I just signed up for Medicare this month. I think I signed up on the wrong plan. Can I change?
Yes. Okay. So here's the way it works, Ted. Yeah, you're fine. You're still within that, sounds like that original 7-month window called the initial enrollment period. So if you want us to help you with that, we'd be delighted to do that. So call in and we'll show you what's necessary. And by the way, if you call in soon, that new plan you pick can go in effect April the 1st.
Yep.
Yep. So you're all right. You really are. Just get moving.
Okay, Charles from Pennsylvania. I already have Medicare Part A and Part B plus Supplemental Plan G. I would like to know if it's worth getting a drug plan.
Okay. I personally think it is, Charles, and I'm going to tell you why. Because right now, based upon your question, you probably either take no meds or very cheap meds. And so it's like, well, why would I have that when I can use GoodRx or, Kubin's Group, Cost Plus Drug Company? Why would I do it? Here's why you do it. Because those discounts, I love GoodRx, and Kubin's thing is wonderful, okay? I like all that. But here's the problem. If you get on Eliquis that costs $600 a month, you're going to get about a $35 coupon off of GoodRx. If you go on a drug plan with Medicare, you may have to meet a deductible, but that $600 medication, once you've met your deductible, is going to cost you about $45 a month. And so the point is, no drug plan is fine as long as we're taking generic medications. But if you get on anything that is brand, you're going to regret not having a drug plan. And listen, you can get on a drug plan for 50 cents a month or zero. There's some of them this year, zero premium. So get on a drug plan for sure. If you don't do it within 63 days of losing a group plan, or you don't do it during your initial enrollment period at 65, the penalties are going to start adding up. It's 1% per month for every month you go without a drug plan. And so the big risk is not so much the penalty, though that can happen. The big risk is if you needed something expensive. I promise you, today I looked up Stellar. It's a psoriatic arthritis, Crohn's disease medication. The normal dosage and frequency, it's an injection that people take, was $13,500 retail. Okay, now let me tell you about that medication. Your first fill would cost you about $3,300, but after that, it's zero for the rest of the year. Now try to get a GoodRx coupon on that. It just isn't going to happen. So that's why you get a drug plan, because of the high cost of meds and now the great cap that Medicare has put on Part D plans. Remember, next year, $2,000. This year, $3,350.
Okay. This is a good question. Troy Holden, I'm on disability and have a G plan. When I turn 65, will I get a lower rate?
Yes, you will, Troy. And the reason for that is because, and again, we'll do this for you. We'll apply during that 7-month window, 3 months before you turn 65, month up, 3 months after. And when that application goes into the supplemental company, they will realize that you are now exercising your right to do what is called IEP2, Initial Enrollment Period 2. So you made the decision to get a G plan, probably had to pay a higher rate, but when you turn 65, you'll get to be rated just as anyone else is turning 65. They're not going to hold that disability against you. All right, so you get to reset the clock. And no underwriting at all.
Bruce. Hello, Marvin. Bruce from Rhode Island. Enjoy your videos on Facebook and YouTube. Suggested to my friends on Medicare. If they are not sure about the plan, to give MedicareSchool.com a call and to talk to an agent about a plan that is good for them.
All right. Hey, Bruce, thank
you.
Hey, keep up the good work, too. We appreciate it very much. That's kind of you.
Okay, I'm 65 in 4 months. My FRA is 67 and 8. Do I need to sign up for Part A, or is it automatic at 65 like I've been told?
No. The only people that are automatically going to be enrolled in Part A and B are those that are already on Social Security. And what I hear you saying is you're probably not doing that because you're waiting. And it wouldn't be 67 and 8 months, by the way. It could be 66 and 8 months. And if you were born in 1958, that's what it would be. And so you take that question that way? Mm-hmm. Okay, so the only people automatically enrolled in Medicare are those that are already on Social Security. So nothing happens for you automatically unless you're taking Social Security, okay? And so, again, if you're still working, and if you don't have an HSA, then I would go ahead and self-enroll into Medicare A. And you can do that through SSA.gov account. And when you come to the question, do you want to take B? If you have a good group plan, say no to B and then have A only. That's the way I'd handle that.
Okay, let's go to another one. This is a two-part question, or there's going to be two. So I recently transitioned from my employer's insurance policy ended 12/23 to regular Medicare 1/24 with a pre-existing cancer condition. Hospital resubmitted claims up to $25,000 not yet paid, and Medicare assumed I still had my employer's insurance. Am I responsible for this amount? I only have regular Medicare now. Wow.
Oh, okay. Well,
There's a lot there.
it's all based upon the service date. So as long as you're on Medicare and the service dates were after you started Medicare, what happened was we call this crossover, and we see this happen regularly. So remember, some insurance companies, including Medicare, they don't want to pay if they don't have to. And so all you have to do, in fact, I can give you the number.
Okay.
I'll give you the number. You can call this number, and you can tell them that there's been a problem with the hospital bill, that you actually were on Medicare, not your employer plan at that time, and then they will adjust it. And it takes about 10 days for that to be corrected in their system, and then you can call the hospital docs, whoever's billing you, and you can let them know that now it is showing up correctly in the Medicare system. Okay, it's called crossover. And it does happen. You're not the only one that's ever seen this problem. So it's the crossover department with Medicare. Here it is. It's called the Medicare Crossover Benefits Coordination and Recovery Center. It's a lot. And it is 855-798-2627. Again, 855-798-2627. Call that number and let them know that you're having a claim problem and you think it's due to the fact that you were on an employer plan, got off that, kept being treated, and now you're on Medicare. And then they will correct it. They'll go in their system and let it be known that Medicare should have been the one paying instead of your group plan. All right? And it should go well. But again, it takes 10 days to kind of correct in the system, have the providers rebill after that.
Okay. This is maybe complicated. Bonnie says husband has had access to TRICARE for Life for 5 years, but currently has FEHB. Would TFL be the better option over FEHB and use FEHB until he qualifies? I know we have to have Medicare A and B to have TFL.
Yeah. Well, hey, and once you retire, you're going to have A and B. That's not true. FEHB will let you have A only. Here's what I would do. If it were me, I would suspend my FEHB if you have TRICARE for Life as an option. There's a form, I can't tell you the name of it, but you can suspend it because what it does, once you fill the form out, you send it into OPM and they will drop off that FEHB premium out of your annuity that you're getting from the government. Because TRICARE is wonderful, wonderful insurance. So don't be paying for FEHB because I know it's not free. So I would take TRICARE for Life, suspend FEHB in case something ever happened where you can get it back, you're not terminating it, and therefore you don't have to pay for it. And then with your TRICARE, you can use A and B, and again, you got to have A and B to have TRICARE. TRICARE pays second to Medicare. And what you may want to look at is what is called an MA only plan. Called Medicare Advantage only, because the MA plan Advantage company actually will coordinate with TRICARE. And the reason there are a lot of TRICARE people who are doing that today is because TRICARE doesn't have a lot of perks. And you can pick up those perks through that MA only plan, and you'll get a reduction in your Part B, somewhere between $50 to $100 a month. And the good thing about you is you can, if you don't like that system, 1 or 2 years down the road for whatever reason, you can terminate your Advantage plan, you can go back and have A and B with TRICARE only. So it's a great option.
Okay, Anthony says, I will be 65 in June, don't need Part B, but should I take Part A?
Take Part A unless you have a health savings account option at your work or your spouse's work. Okay, I think HSAs are wonderful, but when we enroll in Part A, we can no longer put new money in. So if you don't have an HSA, take A only, pick up B at a later date whenever you retire.
Marcia Valdez says, how do I know if I have enough work years to qualify for Medicare Part A with zero premium?
Okay, well, it's 10 years worth of work, 40 quarters. So as long as you work 10 years and you paid into the tax system, you have it. If you want to know for sure, what I would do is I'd just call your local Social Security office, or you can call the national line. I think it's 877 whatever. But if you call your office, they will tell you if you qualify for premium-free Part A. Now listen, if you've been married for at least a year and your spouse is at least 62 and they have 40 quarters, you can draw from a spouse. If you're not married, if you were married to someone that has 40 quarters and your marriage lasted 10 years and they're at least 62, you can draw even from an ex-spouse for your Medicare Part A and B, both.
Can Medicare force you to take a Medicare wellness exam?
No, not at all. No, their annual exams, totally voluntary, I promise you. Now, I will tell you this, Medicare Advantage plans do put some pressure on people sometimes to do some type of exams, but original Medicare is not going to force you at all. They just would not do that. Yeah, I'm glad.
I will be 65, Rod says, at the end of August. Is it too early to start talking about getting plans with you?
Yeah, not at all. August, let's back the clock up. July, June, May. Right around the first part of May, you can begin to enroll. So it's no problem at all. Hey, we'd be delighted to talk with you. Right now, if we're going to do that enrollment for you, then we can submit that as well. So,
Cecilia Graff, I have so many questions. Can I call you?
oh, yes. Yes, Cecilia, well, I just want you to know, I have trained every single agent. In fact, we got 2 new agents starting here in 2 weeks. I'm going to train them. And so they will know exactly what to do for you. All our agents are sharp, very sharp. They'll care about you, no pressure. They will walk you through the process, I promise.
Okay, this is a good question. If you're healthy and you sign up for an Advantage plan, can you switch to a supplemental plan when you get sick?
Well, just depends how sick you get. So here's the way it works. Once you've taken that Advantage plan and you stay on that for a year, 2, 3, 4, 5 years, to get off of that plan, unless you're in those 4 states I told you about, New York, Connecticut, Maine, Massachusetts. If you live anywhere else, if you stay on that Advantage plan for any length of time and you want to move to a supplemental plan because you're sick, you're probably not going to be able to do that because you have to medically qualify. Now, the sicknesses would be things like, let's say you have AFib, or you have rheumatoid arthritis, or you have COPD, or you've had cancer in the last 3 years. And so there's a lot of things. We actually have about 30 questions, 35 questions that we have to ask you, and you have to say no to the questions. Insulin-dependent diabetics, very tough to switch today. If you have osteopenia or osteoporosis, all those kind of things, not going to get to switch. So don't plan, I'm going to take the cheap Advantage plan, I get sick, I get to move. Unless you live in those 4 states, that is not going to happen.
When you pick a supplemental plan, are you required to get AARP?
Okay, only with United Healthcare. They do require. Now, the way that works, just so you know, is it Giselle? You only have to maintain that ARP membership for 1 year. Okay, I think it's $12 a year or $16 a year if you just pay with a check. But that's all they require, 1 year. So, and the only one that does that is United Healthcare.
B. Murphy. Once I'm enrolled into my Medicare with my supplement plan and I live in Illinois, but I move to Florida, do my rates change?
Yes, they probably would. Florida's a little bit higher. And so what happens, you get to keep the supplemental plan, but when you change states, then the insurance companies do have the right to adjust your premiums. I've seen them go down and I've seen them go up. But at least you have the coverage. That's what's nice.
Okay. I'm finding a good question here. I will soon be 65, but my wife is 3 years younger, and we get our health insurance through her employer. Should I get Medicare in addition to the insurance that we already have?
Oh, I wouldn't. Scott, what I would do is just find out, have your wife find out what it cost her to cover you. Okay? Because what you can do is you can have A only. You don't have to take Medicare B. If you're on Social Security, you got to have A. And if you're not, then you don't have to have A or B. So in your position, find out what it cost her to cover you. And our rule of thumb is always about $200, $250 up a month. If she's having to spend that much money on you, then Medicare may be a better value, because more than likely her plan has a deductible with a max out of pocket. And if you go on Medicare and got a G or an N plan, you're going to have a very low deductible, and the total package is going to be probably about $300 a month. Right? So if she's spending, $200, $250 on you and you've got a high deductible, you're probably better off going on Medicare. If it only cost her $50, $100 a month to cover you, I'd stay right where you are as long as there's 20 employees on the payroll or more. If there's 19 or less, you've got to go on Medicare.
Okay, Stephen Wright says, I'm getting ready to go on Medicare July 1st. Cancer patient with $60,000 to $100,000 per year expenses at MD Anderson. High income. What plans that don't restrict my doctors or care? I live in Oklahoma.
Okay. Well, if it were me in your position, I would definitely get a G plan. Because if you go to certain places, cancer, they're going to charge excess charges. N does not cover that. So enroll into a G plan. You're high income. And by the way, Oklahoma, you can probably get a G plan right now, turning 65 for $115, $125, $130 a month. Very good value. It's going to cover everything that Medicare covers except the B deductible. So once a year, you meet the B deductible. This year, that's $240 for the whole year. That's what I would do, Stephen.
Okay, Rob says, I'm just tuning in. If I were to get a supplemental plan, does it come with dental and vision?
No, there's one carrier that actually gives you some discounts on dental and vision, but no, if you want a dental and vision plan, that would be separate. And those are going to cost you about $50 for a good dental plan a month. Vision plan's about $15 a month. But I do want to say this. You don't have to have a vision plan with Medicare anyways. You need one with dental, but vision is well covered by Medicare. They'll cover glaucoma, cataract surgery, macular degeneration, wet or dry. And they'll pay for the shots in the eyes, all those kind of things. So the only thing Medicare does not cover from a vision standpoint would be eyewear and exams for eyewear. That's it. Everything else is covered. Medically necessary eye exams, like I said, any disease of the eye, all that's covered by Medicare very well. If you get a vision plan. If you get glasses, I think it makes sense. But if you don't have glasses, wouldn't do it.
Okay, let's do this one. Can you go from Plan G to from Plan N to G without underwriting?
No, you cannot. You cannot do that, except in those 4 states, all right? New York, Connecticut, Maine, and Massachusetts, you'd be able to do that. But everywhere else, that move from N to G will require underwriting.
Okay. If I'm still working and have benefits through my employer, do I still need to sign up for Medicare to avoid penalties later?
No. Here's the way it works. As long as you're working and there's 20 employees or more, you don't have to do anything with A or B. Remember what I said. Why would you not do A? If you have an HSA, don't do A. If you don't have an HSA, enroll into A only, and you'll pick up B at a later date using what's called the special enrollment period. And with the special enrollment period, the key is all you have to do is make sure you keep working or your spouse keeps working from 65 on, and we go back through and verify that credible coverage. And we do that with a form called an L564. No penalties at all, no problems.
Okay, I'm 67 and still working but want to retire. What's the best plan to get?
Okay.
Live in New Jersey.
Live in New Jersey. I've said it before. As long as you can afford a little extra premium, I would get a G plan or an N plan. I just would. Now, by the way, we write Advantage plans. Happy to do that. I just know that as people get older, we tend to get sick, and then now you can't get a supplemental plan because you have bad health, and so now you're going to be on that Advantage plan. So that's what I would do. Best plan for me. I'm 63. I'll be 65 here in about less than 2 years. I would definitely do a G plan because I want the most comprehensive plan I can get. The extra $25 or $30 is not going to make or break me, but for some people that's important. So then they get an N plan. Still a great choice. Wonderful choice.
Okay, George, keeping it real, says, will you assist us in signing up for Medicare, or do we sign up and call you with our MBI number?
Yeah, we are happy to sign you up for Medicare. What you do need, George, do make sure you have a myssa.gov account. And then we're happy to enroll you into A and B. And if you don't have one, we're so happy to help with that as well. Takes about 15-20 minutes to have a myssa.gov account. Takes us about 5 minutes to enroll you into Medicare. And we do it all day long, George. Call us.
This is an interesting question. Martin says, can you fire an agent if you signed a form saying you were going to use them?
Wow, never heard of that. I've never heard of that.
Yeah, but yes, of course.
Yeah. I mean, I've never heard of someone, I've heard of people firing agents, but never having to sign a form to use them. That's really interesting.
They can't lock you down.
No. You can call the insurance company and just say, hey, I'm done with this agent, this person.
Yeah. That's interesting.
Fire.
Okay, let's do this. My wife and I started Medicare 2/1/24. We haven't contributed to our 2023 HSA yet. Can I contribute before 4/15/24 full or partially to our 2023 HSAs?
Okay. Here's the way it works. So I'm assuming when you say 2/1/2024 that you were both 65 around that date. So what that means is you were still eligible to contribute to your HSA all the way actually through January of 2024. Yeah, I know what he's saying. Yeah, okay. And so then, but that January for this year would only be 1 month. And here's the numbers. Listen, you can put in $4,150 a year, $1,000 catch-up, that's $5,150. Divide by 12 is $430 a month. So you can only put in for January $430 a month for each of you, and that's it. You cannot fund the whole thing. You overfunded it then because it's a prorated amount once you've started Medicare. Now, you can fully fund your 2023, no problem. Now, the only issue would be this. If you started Medicare after 65, they're going to backdate as A date. 6 months. So again, I don't have really enough information to tell you about 2023, but as long as you all were still 64 in 2023, you are fine to fully fund the 2023 amount. But if you're 66, now they're going to backdate that A date, and that's going to be a whole different story. But call the office. Whoever you talk to will tell you what to do.
He says he's 68.
Oh, okay, that's different. What was his month then again? Let's go back.
So
what I have to know is
he
when
started
you,
Medicare
in
2-1.
I'm going to listen. It's from the date that you actually applied. So let's say you applied in December. I don't know when you applied, but you started in February.
He might tell us.
Let's go back. Yeah, tell us when you applied, because I can tell you exactly how much you can put in your HSA then. Okay, going to come back to it.
Yeah, we can come back to it.
Okay, if you tell me when you applied, I'll tell you what to do.
Can you keep an eye on that, Daniel?
Yeah. Okay, go ahead.
Okay. This is a good one. I've turned 65 in February. I'm on Medicare A and B. I've not decided on Advantage or Medigap. I'm in Ohio. Think you plan G. What's the best choice?
Yeah, I think G is what I would do, but people choose N, and it's still a great option. Remember, excess charges don't happen often, and you got a couple copays on your implant. So I think what I would do, Laura, is decide, is that premium difference worth it to you? For me, it's not. I just don't want the additional risk at all. But again, G or N are wonderful, and you're fine, because here's why, Laura. You're still in your 6-month period of time where you can qualify, where you can get a Medigap policy without qualifying. That started in February, so you're fine all of February, March, April, May, June, July. You better apply before July 31, because from that point forward, now you're going to have to medically qualify to get a Medigap policy. So if it were me, I would do it as soon as possible. But you still are in that 6-month window where you don't have to answer any health questions, and they have to cover all your pre-existing conditions.
Okay, back to Tim. He's 68. He applied in January of 24.
Okay, very good. We'll do it then. Here we go. 1, 2, 3, 4, 5, 6. That's 12, 11, 10, 9, 8, 7. Okay, so you should have a 7/1A date. So that means you could have funded for 6 months. So, and last year's number was, I think it was like 38 or 39.50. So look up whatever last year's number was, plus 1,000 catch-up, okay? And divide that by 12, and then multiply that times 6 months, and that's how much money you can put in your HSA legally. 6 months of premium for 2023. So this year, I know it's $430 a month. Last year would have been a little bit lower.
2023 HSA contribution limit.
What is it?
$38.50.
Okay, $38.50 plus 1,000, so $48.50 divided by 6, about 400 and what?
But divided by 12 would be 404.
That's what I meant to say. Yeah,
404
404 times 6. So you can put in about $2,400.
$24.25.
There you go, $24.25, and you'll have no problems per person. Well, let me back up. Yeah, the 1,000 is for both. If they have individual accounts,
okay.
yeah, there you go. So, anyways, you still got that. So that would be the family plan. It's still only 1,000 catch-up for the family.
Okay. Let's answer another HSA. We're on it. Rob says, I quit putting into my HSA plan January of this year. I no longer put into my HSA plan. My employer put $900. Of course, we don't know anything about Rob, so never mind. Let's not go with that. Here's a good question. James, does Medicare cover it if you need a helicopter to fly you to a hospital in the States?
Yes, it's air ambulance and ground ambulance for sure. So the only thing you'd have to meet would be your Part B deductible, and then if you had a G plan or N plan. If you don't have one of those plans, then you'd be responsible for 20% of that cost. But they do cover air and ground. And I don't know all the stipulations for that. There could be some rules, but I've never had a client, at least in states, have to use a helicopter. Yep.
I'm in North Carolina, says Faith, turned 65 on 11/20 and already receiving Social Security. I have 0 health issues or medications that belong to the Y. Sounds like I should choose an Advantage plan. It would be only for November and December.
Turn 65 on 11/20.
Yeah, 11/20 of this year. So like 11/20, 1959.
Oh, I see. Okay, very good. Oh, I understand that. Okay, 0 health issues. Okay, and that would be fine if you want to do that. You'd still, what my recommendation, Faith, is I wouldn't keep that any more than 6 months, for sure, because then after that, you stay on that Advantage plan beyond that, now you're going to have to medically qualify to get off. So if it starts in November, if you did November, December, then you could get off the Advantage plan and go on a supplemental plan in January. So as long as you can afford the premium for the supplemental plan, that's what I would do. If it's worth that to do it for 2 months. Totally up to you.
Okay, let's do. My wife started collecting Social Security at 62 and a half. She'll be 65 December 20th, 25. Medicare kicks in automatically. Do we choose a supplemental plan at that point?
Yes, you do. That's right. Yeah, she'll have her B date, and you'll be ready to go.
Let's see. I turned 65 in July. I'm in California. I want a PPO because I need to keep some of my doctors, like my oncologist, and I need prescription coverage. What do you think would be best for me to sign up with?
Well, I mean, I don't think you can talk about carriers
Yeah,
right
no,
now. I'm
talk about
sorry. Yeah, we write a lot of business in California, by the way. So why don't you call us,
Yeah.
and we can tell you who has the really the best rates and the best stability in the state of California, and it will be actually better than a PPO. Yeah, remember, PPO is still going to be advantage. But if you take a supplemental plan, then there's no network at all. Go wherever you want as long as they take Medicare.
Maria says, my hubs and I turned 65 in May. He continues to work for a large company and will continue with his employer plan. I'm covered under his plan, but work for a very small company. Do I need to enroll in Med A?
No, you're not required to because your small company does not come into the picture whatsoever. If he is covering her, is that right? Yeah, covered by his plan. You're fine. Now, if you're taking Social Security, you're going to be enrolled in A anyways. But if you are not, then you may choose to enroll into Medicare A as long as you don't have an HSA. In fact, Maria, that's what I would do. It's fine to take A only as long as we don't have an HSA. And all it's going to do is pay second to his group plan anyways.
Okay. Federal retiree with FEHB turning 65 October 24. Plan to get Medicare A and B with FEHB as secondary. Can I later drop FEHB and enroll in a G supplement with no medical underwriting?
Okay.
Probably talk about the impact of getting a sup plan from FEHB as well.
Yeah. So, so involuntary loss of I don't think you can because if you're retired, that means your Medicare A and B is started. So you have that 6-month window where there is no medical underwriting. So if you choose to stay in the FEHB system with A and B to get a G plan, you're going to have to medically qualify to do that after 6 months of your B date. Now, I will also tell you, if you decide to do that, you're going to have to sign paperwork terminating your FEHB benefits. Because once you've taken a supplemental plan, that OPM form, you got to check off the box, and it says, I understand that I am terminating FEHB. And that only happens when you get a supplemental plan. You get a Medicare Advantage and just suspend. But the supplemental plans, you're terminating FEHB forever. And so I've had plenty of people do that in my career, but you want to make sure you're comfortable with that. But yes, you're going to have to go through underwriting after 6 months of the B date. Because it's loss of a retiree plan, not loss of an employer plan. Right?
Okay. My husband is over 65, currently on my employer medical plan. If he doesn't prefer Medicare, can he switch back? And what happens when he finally goes back on Medicare? So let's say he goes on Medicare because he just wants it. Can he go back and forth?
Okay.
Basically.
Well, if you do that, you'd only want to do that one time. So if someone's on a group plan and they go on Medicare, then yeah, you can drop it. You can actually stop your Part B of Medicare. But I wouldn't go back and forth and back and forth. That's going to get real messy. Maybe one time only. That's it. So the answer is yes, once. You could technically do it multiple times, but I guarantee you're going to create a huge problem for yourself because you can only restart B one time. Yeah, they'll go back and backdate it.
Some of these questions. I currently receive Social Security. Do I have to sign up for Part B, or is auto-enrollment going to do it for me?
You'll be automatically enrolled into A and B. And if you're no longer working, your spouse is no longer working, covered by a group plan of 20 or more, you're going to stay enrolled in A and B. But those people that are automatically enrolled in A and B that have a good group plan, you can actually suspend the B. You can delay the B. You send the card back in or fill out a form called a 1763, and then you can again terminate that Part B. Only if you have a group plan 20 or more and it's attractive.
Danish Opry says, if your spouse is contributing to HSA and you are under health policy, can you enroll in A?
Well, if you enroll in A, she can no longer make contributions to the family plan. She can still contribute to her plan. So if you have an HSA and you're covered by her group plan, I would not take A. I wouldn't. And it's going to go in the second payer position anyways, which Medicare A in the second position doesn't pay a whole lot. It pays co-insurance only. So I would keep the HSA, keep contributing.
Okay. I will be turning 65 this August. Plan on calling you in May to sign up for a plan Energy, but wonder if I would still qualify for any of the Medicare Extra Help Savings programs.
Okay.
We'll help you.
Okay, yeah, exactly right. Sure.
Charles says he is very low income.
Okay, yeah, you probably would and I think right now the numbers for a single person, boy, I don't know, Josh, 19,000 or something like that below. You can actually just Google that Medicare Savings Program qualifications, and if it asks you for your state, they'll tell you exactly what those numbers are. They'll look at income and assets.
Okay, Truth Has It says, I will be 65 in September. I have applied for retirement. I'm assuming
Social Security.
Social Security. How do I enroll in Plan G and a drug plan in September when Medicare starts? I have the marketplace insurance now.
Good. Okay, let's back up the clock. So you're going to turn in 65. So we go back August, July, June, so May. You're really very close to that time frame where you can begin to start looking at plans. We can actually enroll in most states people in the G plan 6 months before their B starts. And the drug plans are not going to change this year. So you actually can call in any time and start making those decisions. So you're fine now, and you're fine to wait another month or two at most. Just call us and we'll help you through that whole process. That marketplace plan needs to go away your birth month.
Yeah.
You have to call and cancel that.
Will I always have to pay for Part B?
Yeah, unless you qualify for Medicaid, you will have to pay your Part B premium. That's correct.
Ed in PA. Which supplemental plan is better in Pennsylvania? G or N? I was told doctors cannot charge extra fees in PA, making Plan N a better deal with it being lower premium than G.
Hey, and that's fine. And you're right. There's 8 states. Pennsylvania is one of them where the providers cannot charge excess. Now, you could go out of state and still experience excess, but it's still a very low risk. So I think your decision to take it in would be just fine, for sure.
Okay. Is the dental plan under $50?
Yeah,
Yeah,
you
man,
can.
yeah.
I said that's the ballpark. There's some that'd be $45 or so. You're not going to get a decent plan for much less than $40.
Yeah. Call our office. We'll shop them
Michelle,
around for you.
yeah, we write multiple dental plans every single day. Happy to help you.
Okay, my wife and I are retiring in June of this year. Hey guys, by the way, so this is a comment coming from somebody inside of our Facebook group. So we've got a Facebook group. It's got 40,000 people, I think, in it. And we are active in that Facebook group all day long. People are asking questions, getting real feedback from our clients and other people who are on Medicare. And so I encourage you, if you're a Facebook user, look up Medicare School on Facebook, and you're going to see a Facebook group. In fact, we're going to drop a link in the chat. Daniel's going to do that. So we'll put a link in the chat. You can actually click on that, and you can join the Facebook group. And you can go in there and ask whatever questions you want, and we would be honored and happy to answer those questions. So it's called the MedicareSchool.com community, a group for people learning about Medicare. There's 37,900 people in the group right now, and so let's get that over 38,000 tonight. Go ahead and pop in there.
And also every Monday night, almost every Monday night, unless it's a holiday, I do what we call Medicare Mondays. 5 o'clock Central Time. I did one this week. And so we talk about all the current topics going on with Medicare. Usually have about a 30 to 45-minute session. We'd love to have you be part of that. And we'll send out reminders for every Medicare Monday.
You could only get that inside the Facebook group. Okay, my wife and I are retiring in June of this year, and we currently have Part A Medicare and use our work medical plans. My question is, can we call your company and go ahead and get signed up for Part B and a Medigap plan and have it start in June 1st this year, but sign up now?
Yeah, absolutely. You're all set to go. Now remember, in order to bring you into B, now that you already have A, your employer is going to have to verify credible coverage back to 65. So I don't know how old you are, but if you're 66, That form's going to be filled out verifying credible coverage, and that'd be forms for each of you. And that paperwork would then go in with another form telling the Social Security office that you want to start Medicare June 1. It's called the L564 and the 40B, and it goes to your local office to make that happen. But our staff would do all that for you. The only thing you have to do is make sure your HR department fills it out. Okay? And we'll walk you through the process.
Okay. This is a good one. I thought no one can get a plan in anymore.
No, people can't get F plans anymore if they're born after January 1st, 1955.
F is in Frank.
F is in Frank, right? N plans are still around, and here's the facts, folks. Of all people buying supplemental plans today, 70% buy G's, 30% buy N. Yeah. So they're both great options.
Okay, if I live in Cincinnati, Ohio, this is Joe from our Facebook group. Hello, okay, Joe. Yeah. If I live in Cincinnati, Ohio, but want to go to my specialist at Cleveland Clinic, can I do that on Medicare?
Absolutely. Yeah, I am positive that Cleveland Clinic takes Medicare. I don't know if they take any Advantage plans. They may take some, but they certainly going to take original Medicare and your supplemental plan.
Okay, if you are working, another HSA question, and have health insurance through your employer, and by 65 you get Medicare Part A, but you made your employer healthcare primary, so you can you still contribute to the HSA?
No. Yeah. And by the way, I never really know what you're asking, but just so you know, you and I don't decide who's primary. Medicare's already decided that. So if you're still working and the group is 20 or more, Medicare is always in the second payer position. 19 or less employees, then Medicare is the first payer position. Anyone who's retired, Medicare is always in the first payer position. So they have already decided that. Stephen, but if you have A, no new money goes in the HSA, no matter who's first or second payer. Doesn't matter.
Stephen also says, I'm thoroughly impressed with your command of this subject. I'm a physician and know that patients with Plan G have less obstacles to receiving care if they have to come in for frequent visits. Yeah. I'll be calling to sign up for G through you.
Hey, Doc, I appreciate you writing in. Thanks for the encouragement. I will tell you this, interesting. I do a lot of reading and all that kind of stuff and really enjoy it. But I read something, a doctor actually was writing the article. That's not a true statement. Let me rephrase that. This guy used to run a CMS and now he's retired, and he was being interviewed. And he made this statement. He said, I ask doctors all the time that are retired, are you on an Advantage plan or a supplemental plan? He said he's never had one single doctor say they were on an Advantage plan at all. So because, hey, you all see it in the real world. The problems with these Advantage plans that people will experience occasionally or frequentanya
Tanya Lewis, I'm retiring in May. I'm 67. I already have Medicare Part A. When do I need to get Medicare Part B?
It's time to do it. It is, Tanya, you need to get that L564 filled out and the 40B filled out. Of course, the 40B is just you and your own. The L564, you initiate and then give it to your HR department. And again, our staff would do that for you. We'll fill it out.
Yeah, we're happy to do it, but I'll also put the instructions on the screen here. To enroll in B after 65, use CMS L564, employer fills this out. CMS 40B, you fill this one out, and then both of them go to the Social Security office.
Exactly right. And if you've changed jobs after 65, you may need two of those because we have to have every month accounted for back to 65. And for those of you who are going to keep working and stay on employer plan, it's fine to do so. Just make sure you don't go without coverage if you change jobs because that can come back to bite you.
Okay, suppose a person doesn't have 40 work credits. Would he still be penalized for not signing up for Medicare at the right time?
Absolutely. Once you're first eligible, whether it's premium free or not, they start adding on the penalties. And the way it works for Medicare A, for every year you go without A when you should have had it, it's a 10% penalty, double the years. So if I go without 1 year, I pay the 10% penalty for 2 years. If I go without 2 years, I pay 20% for 4 years. And the B penalties are 10% for every 12 months without for life. In fact, we had someone, I think I saw a comment earlier, they went without for 7 years, and they have a 70% penalty added to Part B, and that will be for life. Eligible or not, doesn't matter. In fact, we have this happen when people come out from out of the country and come to America. Same thing. Yeah. There's no mercy there for you. It's based upon age.
Kiss's greatest fan said, I appreciate all the videos you've made. I signed up for a Med Advantage. Is this better than a Medigap plan? I am 66, retired, and collecting SSI. Live in Massachusetts and have Part A, B, and D.
Okay.
But it doesn't look like, well, she signed up for an Advantage plan too.
Okay. Yeah. Well, your Part D plan would be embedded within your Advantage plan. Here's the thing. I think there's a place for Advantage plans. If someone's budget is really, really tight, I think Advantage is a great option. If you're a veteran or have TRICARE or FEHB, I think Advantage is a really good option. So KISS, as long as you are comfortable with pre-authorizations, you're comfortable with networks, and you're comfortable with the risk of the max out of pocket, your Advantage plan may serve you well. But if you don't like the way that works, the Advantage system, then I would then recommend a supplemental plan. They're easier to work with. You don't have to have the insurance company interfering. And just, I'm going to be frank, folks, the reason that agents push Advantage plan is twofold. Number one, we get higher commissions and we get longer commissions. We literally get lifetime commissions on Advantage plans. Not so with supplemental plans. We get paid, 6 years? That's the way insurance works, by the way, is residual. So agents push Advantage plans because they pay us better. But I can't pillow my head at night with a clear conscience unless we've told you about both and tell you how both work and the consequences of both of those systems. And by the way, we're not the only ones in this business that feel that way. There's a lot of people that have been at this a long time who know exactly how Advantage plans work, so they also warn people about those consequences.
Yeah. Okay. I was born in 1952. Would I have to go through underwriting to change from an Advantage plan to a supplemental plan?
Yeah, really, it just depends on when you started the Advantage plan. So you're eligible for Medicare in 2017, so I'm assuming that you probably have been on it for a while, so yes. Now keep in mind, Cam, you can do that right now, but only for another 10 days, because to get off an Advantage plan and move to a supplemental plan, you can only do that 2 times a year. January 1 to March 31, October 15th to December 7th. So you still have a couple more days where you can do that. So you can return to original Medicare, but we would not cancel your Advantage plan until we had approval on the supplemental plan. And so the timing has to be right, but you can do it right now. You just have to make sure you qualify. So call us and we'll let you know whether you can or not.
Okay. My drug plan Aetna doesn't now cover my chronic pain meds. Can I appeal this? The plan doesn't do much for me otherwise.
Yeah, what I would do if I were in your situation, Stephen, is I would ask for a formulary exception. And there's some paperwork that has to be filled out. You can do it, your doctor can do it. And so if there's a certain pain med, you want to ask them to add that to your formulary. And many times they will. Now, it could be that your pain meds are, if they're brand name, they may ask you to try generics first. But it's called a formulary exception, and they almost always do grant those. So that's my approach. So you can call the customer service on the back of your Aetna card and ask them what process that you have to follow to make that happen, and fight it. I mean, you can usually win that.
Good. Interesting. I'm 72 and continue to use my job group plan. Now I wanted Medicare Part B, but told I have to prove I was covered from 2016 to 2023 to avoid a penalty. I can't get 2016 proof. 2017 to 23 can be proved.
Okay, here's the way this is going to work, Linda. Here's what I would do, and you got to get on this real quickly. We're still in the general enrollment period. So what I would do, if you can't get it, you can't get proof for that, you may just have a small penalty, but get the proof that you can. And what you'll do is you'll submit that with your 40B form and put in the comments section that there were a couple months or a year, whatever it was, and then provide the L564 and submit all that together to your local Social Security office. You can fax it in, mail it in, drop it off, but do it by the end of this month. And so you'll come in using the general enrollment period, but as long as you have those L564s, your penalty should be minimum, okay? And so I've done that. I've helped people with that process. So hopefully that makes sense for you. So you have to pay some, but it should not be very much as long as you have most of your years covered. It'll be a very small, because here's the way it works. For every 12 months you go without, you have a 10% penalty. So if you only went out without for 8 or 10 months, you're still not going to be penalized. It takes a full 12 months before the penalties begin.
Okay, what companies of Medigap plans have the most stable, lowest rising premiums over time? Does your company have data and guidance about what companies have stable premiums?
We do. And through this platform, we just can't mention names. We write for lots of carriers, but we just can't talk about them. But if you call in, our agents can show you, and then again, we'll do a screen share with you. We'll show you exactly what we look at to see what price increases these companies have taken for the last 10 years. And almost all the carriers report this. I think there may be a couple regional carriers that don't, but we don't necessarily recommend regional carriers anyways. We like the national carriers. They tend to be larger groups, therefore more stable rates.
Okay, we're just going to answer a couple more questions, and then we've got to wrap it up for this evening. So let's do this. It's a good question. Marsha Valdez, does Medicare coverage begin on your birthday month if you sign up 3 months early as allowed, or is it calendar year coverage, January to December?
Okay, yeah, it's your birthday month unless you're born on the first day of the month. So let's say someone has a birthday April 1, their coverage for Medicare could begin March 1. So if I'm born on the second day thereafter, it's always when I turn 65. So when you count those 3 months, it's 3 months before your birth month, month of, and then 3 months after that you can apply for coverage. So it's really not about calendar year. Now the Medicare Advantage plans are calendar year. Drug plans are calendar year for sure. But Medicare A and B is not based upon calendar year at all. The B deductible is calendar year, right? So we got a couple things that are calendar year, but not original Medicare.
I don't know if you can answer this. Maybe you can. Folks retire early and move out of the U.S. before age 65. What's the correct procedure to delay signing up for Medicare? Yes, they sign up when they get back to the U.S.
Yeah, I've heard of that. I really don't have a lot of experience with that, but I think as long as you're in a country where you can prove that you did have some kind of an insurance, I think when you get back in the U.S., I do think you can sign up for Medicare at that time. And I'm sorry, I'm not fluid in that.
Okay, the decision for G or N is determined by whether you might need a hip or knee replacement. The copay for G may be more expensive, but if you have PT 3 times a week for a few months, then G is better.
Yeah,
Great point.
yeah. Hey, I would totally agree, Mark.
Because you're going to be spending $20 probably, or more. Yeah, 20
Oh, yeah.
probably, every time you have that PT.
Exactly right.
Let's see.
Good comment, Mark.
I'm 68. If I go back to work, should I suspend supplement on Part B if I find employer plan is worthwhile?
Yeah, exactly right. Yeah, as long as it looks like the employer plan is really, really attractive, or maybe your spouse is also covered by it, it is fine. So you're not going to suspend the supplemental plan. You're going to cancel it, but you are going to suspend your Part B. And the form that you do that with is called a 1763. You can Google that, 1763. And when you see the form, it calls Part B supplement. It's not a supplemental plan F or G or N. They call supplement Part B. So you'd put on there that when you want to terminate it and the reason for that, and then you can come back in at a later date. Now remember, you got to have employer coverage now in the future until you're ready to retire, but it's fine to do that. So we terminate, cancel the sup, and then suspend Part B. And it's smart to do that if the group plan is good.
Okay. Talking about medications, if you have a chronic condition, diabetes, AFib, and you have an adverse reaction to the generic recommended drug, do you still have to go through the formulary exception?
Okay, no, you don't. The doctor would need to provide that information then for sure. That's the same thing with any kind of prior authorization medication as well. Doc says, hey, we tried that, doesn't work, and they typically will then fill the brand.
Okay, can I make an appointment and come to your office instead of talking over the phone?
You sure can. We're right here we're Overland Park, as Josh said, in Kansas City. So if you want to come in, do it. Just call the 800 number and let us know you want an appointment, and we'll see you knee to knee, face to face.
Stephen R. says, this is the last question for tonight, guys. How can I switch to you guys from a different agent?
Yeah, well, it just depends on the carrier, really.
Generally, you would have to switch plans.
Yeah.
So come to us, during one of the enrollment periods, and we would be happy to help you. Oftentimes, if you sign up for a plan with somebody else, that's kind of your agent.
Yeah, it really is.
For life.
And we're happy. Hey, you can join these events, ask questions, go on the Facebook group. We can still give you some assistance. But Josh is right about that. So.
Okay, everyone, thank you so much. This is something we really enjoy doing.
Hey, we love this.
Doing it every couple weeks. So if we didn't get to your question, we apologize. We will do our best to get to it next time. But thank you so much. If we can help you in any way, call that phone number that's scrolling along the bottom of the screen, 1-800-864-8890. I'm going to go ahead and put that up a little bit bigger.
And then we try to do these about every 2 weeks. So tell your friends about us. We'd be grateful if you did. And we'll help anyone that's ready to go on Medicare.
Thank you, guys.
Yep,
Take care.
Take care. See ya.